Guys, Dr. Glenn here. I was going to show you guys how to reconstitute your peptides. So you'll get them in a folder like this. This is going to have some syringes and some alcohol swabs. And then it's going to come with a bacteriostatic water and then the peptide here, okay? So the label is going to have instructions for how much bacteriostatic water to add to each vial of your peptide. For example, for this BPC 157, we are going to add 3 ml of bacteriostatic water to the peptide. We're going to mix it, and then the dose is 15 units. So each of these has this little flip top. So to start, you just pop that off. Okay, and once it comes off, it doesn't go back on. It's just a one-time deal. Okay. Now, each time you use this, you should wipe the top off to prevent contamination. This is an alcohol swab and it just sterilizes the cap, okay? You don't need to wear gloves. Gloves protect us from other patients' germs and stuff, so if we're just working on ourselves, we generally don't need to wear gloves, okay? So here's the syringe. So if I'm going to add 3 ml of this bacteriostatic water, I'm gonna need to fill this 1 cc syringe up 3 times, 3 separate times, each time adding that to the jar. So I'm going to pull back 1 ml or 100 units of air to start. I'm going to access this right through the very center of the bacteriostatic water. I'm going to inject that air first, and then I'm going to draw back the plunger to get the full 1 ml of water. The needle's really small, so it takes a little time. Here's 1 ml water going into the peptide jar. Okay. 1, 2. Okay, so I've got the 3 ml of water in this syringe, and your specific peptide may require a different amount of water. Some do. So just shake it up until you see that there's no more solids in there. It's all dissolved. Okay. And some of the peptides have a different color to them. They're purple or sometimes red. That's okay. That's just specific to the peptide. Okay. Now I'm going to go ahead and do my first dose. I'm going to again clean the top of the vial. I'm going to get a fresh syringe here, clean syringe. In this case, for BPC 157, the dose is 15. So I'm going to pull this 15 units. So I'm going to pull this back to the 15 mark. I'm going to put the syringe in through the center and inject that air into the vial. If it doesn't go easy, it may be that you're not right in the middle. You got to be right in the middle there. And then now that liquid is going to come back and fill the syringe up to the 15 mark, between the 10 and the 20. All right, good. Then we got that. I'm going to clean whatever spot on my body. In this case, I'm going to do it in my arm just so you guys will see. BPC 157 can go anywhere in the body. Some people like to use it close to the injury. It really doesn't matter. So I'm alcohol. And then I'm going to just insert the needle all the way to the hub and inject it in like that. Such a small needle poke, does not require a Band-Aid or anything. And I get to enjoy the effects of some high quality, safe, tested peptide under doctor supervision. Have a great day.